PHP level of care and intensive outpatient are not interchangeable. Billing them with the wrong code triggers denials your team could have prevented. Partial hospitalization and intensive outpatient share the same continuum, but have completely separate billing code families and authorization requirements. This guide covers what separates PHP from IOP, clinical intensity, ASAM criteria, billing codes, and documentation your team needs to get paid. Level of care definitions, ASAM criteria, billing codes, prior authorization, and how Behave Health is designed to support the workflow. A PHP program, partial hospitalization program, provides intensive psychiatric and therapeutic services without requiring overnight stays. Patients attend 5 to 7 days per week for at least 5 hours each day, then return home in the evenings. Under the ASAM criteria, PHP corresponds to Level 2.5, partial hospitalization services. In most states, PHP is licensed as an outpatient service, even though the care intensity is very high. Prior authorization is almost always required before a patient starts a PHP. Failing to get pre-authorization can result in denied claims. Blue Cross Blue Shield plans require a behavioral health case manager call before admitting a member. Call after admission, and the claim may already be denied. Billing a PHP per diem code when the patient was authorized at IOP level, or vice versa, triggers a code level denial that requires manual appeal. Missing daily progress notes is not a paperwork problem, it is a reimbursement problem. 4 things that separate PHP from intensive outpatient: schedule, ASAM level, billing codes, and Medicare thresholds. Let us go through each one. First, schedule and intensity. PHP keeps patients engaged 5 to 6 hours per day, less idle time than intensive outpatient, more flexibility than residential. Intensive outpatient is typically only 3 hours per day, several days per week, the right step once a patient is stable enough. In early recovery, PHP fills the day with therapeutic activity while still allowing time for employment and 12-step meetings. Second, ASAM level. PHP corresponds to ASAM level 2.5, the most intensive outpatient level in the ASAM framework. Intensive outpatient corresponds to ASAM level 2.1. Many states use ASAM criteria directly in their licensing rules. When a payer questions medical necessity, ASAM level criteria is the framework your clinical team argues from. Third, billing codes, the most operationally critical difference. H0035 is the standard PHP per diem code, mental health partial hospitalization, less than 24 hours. Accepted by Medicare, Medicaid, and most private insurers. H0015 is the intensive outpatient per diem code for substance use disorder programs, alcohol and drug services, per diem. S9480 is the mental health intensive outpatient per diem code. Like all S codes, it is for private payers only, not accepted by Medicare or Medicaid. Fourth, Medicare thresholds. For Medicare PHP, the patient's care plan must document a need for at least 20 hours of therapeutic services per week. For Medicare intensive outpatient, covered as of 2024, the threshold is at least 9 hours of therapeutic services per week. Missing the documented hour threshold is one of the most common and avoidable causes of medical necessity denials at both levels. One study found that 92% of acute PHP patients showed improvement by program end, and only 5% required readmission within 30 days. Source: Predictors of outcome of acute partial hospitalization, ResearchGate. The data hold only when daily documentation substantiates what was delivered. Authorization is where most PHP revenue problems start. Prior authorization must be obtained before the patient is admitted. Calling after means the claim may already be denied. Payers authorize PHP or intensive outpatient specifically. Services provided above the authorized level are not covered without escalating the auth. Behave Health is designed to support the full PHP operational workflow, documentation, billing, and authorization in one place. Daily PHP notes connect directly to billing. Documentation that supports medical necessity flows into your claims workflow. Behave Health's RCM module can be configured to automatically apply correct per diem codes and bill only 1 unit of PHP per day. Track authorization windows and concurrent review deadlines so your team is not managing auth expiration in a spreadsheet. Stop losing PHP revenue to preventable code errors and missed authorizations. See how Behave Health connects documentation to billing. Book a demo. Book a 20-minute demo at behavehealth.com.